Hello, I'm Brooke Satchwell. When it comes to looking after our teeth and gums, there are 4 easy steps that we need to follow. We need to brush twice a day, floss, rinse, and visit the dentist for regular checkups. Colgate have sponsored this educational video to help children learn correct oral care habits they can take into adulthood. Fortunately, it's all very simple. Throughout this video, we will cover what to use for the best oral care, how often to brush, when to replace your brush, some tips on taking care of your child's teeth, and the correct brushing technique. Fluoride in toothpaste helps to fight acid, prevent dental decay, and help repair early decay in both children and adults. Children under the age of 6 do tend to swallow when brushing, so they should be given a low fluoride toothpaste. After age 6, children should use a pea-size amount of regular fluoride toothpaste. But to make sure, do encourage spitting rather than swallowing after brushing. It is also important not to rinse with lots of water after brushing. This ensures maximum fluoride levels remain on the teeth. Brushing twice daily using fluoride toothpaste is one of the most proven ways for you and your children to remove plaque and stay free of tooth decay. Yet, the latest research shows that only half of children aged 1 to 10 brush their teeth twice a day. It's vitally important that twice daily toothbrushing becomes part of a child's daily routine, much like washing your hands or brushing your hair. By doing that, they can carry these habits into adulthood. The reason why that's important is because Australian research shows that adults who brush more than once per day with a fluoride toothpaste experience 3 times less decay than those who brush less often. Now, when it comes to growing children, it's not just shoes and clothes that you need to replace. You need to make sure that you replace your child's toothbrush every 3 months or when it begins to wear. It's also a good idea to replace it after your child has had a cold. Here's a few facts and tips on brushing to help you take the best care of your child's teeth. Toothbrushing should begin when the first baby teeth appear in the mouth at 6 to 9 months. At this age, you should use a small, soft-bristled toothbrush to gently brush your child's teeth. Later, you can give your child a toothbrush to play with at bath time. This helps to introduce the idea of brushing their own teeth. When it comes to toddlers and small children, the ideal toothbrush has a small head and soft bristles. This has a handle that's easy for little hands to hold, and it's designed to make it easy for them to brush all areas of their mouth. Regardless of their age, you should always supervise young kids at brushing time. Kids don't have the coordination to brush properly until they're 8 or 9, so you need to help them until you're confident that they can brush properly alone. Now, brushing may seem pretty simple, but there is a technique to it that will help keep your family's teeth in tip-top shape. Teach your kids the right way and they're more likely to practice it for life. When brushing, it is important to brush every surface and use short, gentle strokes. Tilt the brush at a 45-degree angle to the gum line and sweep the brush away from the gum line or use a gentle circular motion. First, clean the outer surfaces of the upper teeth, then the lower teeth. Next, clean the inner surfaces of the upper teeth, then the lower teeth. Finally, clean the chewing surfaces using a gentle scrubbing motion. Make sure that you and your children pay extra attention to the gum line, back teeth, and areas around fillings, crowns, or other work. And to remove bacteria and freshen breath, the tongue can be gently brushed too. When it comes to brushing, doing it quickly is not enough. Brushing teeth properly takes a full 2 minutes. If you set up this habit early on, your kids will benefit for life. Finally, the golden rule for kids, regardless of their age, is to make sure that their teeth get a good brushing before bedtime. It is really important that your child regularly visits the dentist. Don't wait for a problem to occur. In the recent National Oral Health Survey, people who visited their dentist for a checkup had 2.3 times less decay than those who only visited when they had a problem. So, let's recap. For the best oral care for your child, make sure you use fluoride toothpaste, brush twice a day, replace your brushes every 3 months, teach your child correct brushing technique, and of course, regularly visit the dentist. Colgate hopes that this information has been helpful. It's so simple, but so important. With the correct oral care habits, you can put your kids on the road to a bright smile that lasts a lifetime.